Van Duyne.
Thank you very much, Mr. Chairman. You know, many of you may not know this. I got into politics because when my daughter was born, she had 9 surgeries on her eye. When she was first 12 hours old, first child and not at all what you'd expect. And when she was 12 hours old, she was diagnosed with a cataract. She had to have that removed. She subsequently got glaucoma and had to have a number of surgeries to fix it. And I remember when she was about 4 months old, one of the biggest surgeries she had to have, 2 days before the surgery, it was denied by the insurance company, one of the insurance companies that's here today. There was one surgeon in the entire state that could do the work on her eye, one. And because it was out of network, it was denied. And I remember having to go and fight, threatening actually to bring news cameras in the 4-month-old down, explaining exactly what happened. No medical doctor, as far as I knew, had reviewed it. Ended up having the surgery, fought after the fact, but it really drove me into running for office, having to protect her and recognizing how frustrating it was for parents and for families and for people who are going through some of the toughest times of their lives to have to fight with insurance companies. And since Obamacare started, we're looking at denial rates that have gone up considerably, almost 20% now, in some cases even more than that. We've looked at the largest health insurance companies. Your revenues have tripled in the last decade. Profits have tripled since Obamacare started. Denial rates are up and only grown in the last 10 years. And almost half of the denials are overturned. But it's still the gut fight and having to do it and having the providers have to fight and how much time we waste on that. You know, in 2025, the average family premiums for employer-sponsored coverage hit $27,000 annually, with workers shouldering over $6,800 on that out of pocket. And for 2026, ACA marketplace premiums are surging. I mean, we're seeing averaging about, 26% more in many cases. It's driven by a lot of things: unchecked hospital costs, exploding drug prices, a system rigged to make things, not have competition. But some on the left, I understand, are pushing for increased subsidies. It's a Band-Aid. It's a Band-Aid solution for a broken system. And unfortunately, it seems to incentivize insurers to jack up premiums knowing that the subsidies are going to follow and sticking unsubsidized families and taxpayers with the bill. The GAO has exposed massive fraud, $21 billion in unverified credits, fake applicants, and seemingly zero accountability. And instead of pouring more money in, we need to have ironclad reforms to root waste, fraud, and abuse out. And look, I get it. The government has not helped, right? We have fueled this mess. We've got layers of mandates, regulations, a one-size-fits-all marketplace that stifles innovation and it drives up costs for everyone. But we also need to have some bold reforms, which I'm hoping, since you are so involved, and as the chairman has mentioned earlier on, so involved in every aspect. I mean, we're hoping that you are going to, because you do get so much money from this, are going to be providing some of these solutions, whether or not this is having more affordable care, not affordable care, but associated health plans, so that businesses can group together and have more competition, slashing and identifying what their red tape looks like, expanding health savings accounts with greater flexibility. These are things that we need to do, but we also have to hold the insurance companies accountable. Demand price transparency and abusive prior authorizations, denials that block care. Ensure competition forces real delivery and value, or else you lose customers. And executive pay is a big deal, and I know that in ENC this morning you guys had to deal with that and had a lot of questions. I haven't heard it yet from our committee, but top CEOs at some of these major payers have earned $20 to $26 million or more in recent years, with pay ratios hundreds of times that of average employees. When profits are coming from a lot of public funds, compensation should reward delivering affordable and accessible care and not rewarding denials or excessive overhead. Just by a show of hands, how many of your executive compensation models are tied directly to premium affordability, to claim approval rates, to patient outcomes, and then to reducing unnecessary denials? Given your company's scale and reliance on federal dollars, and I'm hoping, and you don't have enough time to answer this question now, but I'm hoping that you will all recognize the responsibility that you all have to lead on Medicare reforms rather than simply operating within the broken system and just collecting federal subsidies. Thank you for your time.
Mr. Schneider.